how do you manage expectations for the outcome of a procedure? Because as you said, like this is something that people can really see, and it's not like any other field of surgery. So how do you talk with patients about that?
So, one of the things that I tell patients is it's really important for me to understand your goals and basically what your expectations are. So, during the evaluation and the consultation, I try to manipulate tissue to try to kind of show them, okay, if I remove the skin, it's going to look like this, or if I lift the breast, it's going to look more like that. And then we also look at photographs. So I ask patients often to like bring me 3 pictures of what they love and 3 pictures of what they don't like. And so we kind of look at those photographs so that I really understand their aesthetics. And most patients come in with an idea of what they want their body to look like. But I think if you sit down long enough and talk to them about, well, here's where you're starting and here's your anatomy. And based on where you're starting and what your anatomy is, here's what you can expect. And these photos are really nice, but you don't have their anatomy. So to expect to look like this patient is unrealistic. Patients then kind of go, okay, I will change my expectations. I understand what's achievable, what's not achievable. I think the way that doctors kind of get into trouble is not really getting into the patient's heads, not really understanding what they want. I kind of know what I can achieve. But unless I convey that to the patient and the patient says, yes, that's in line with what I want, you're going to have a lot of unhappy patients. So I think it's really spending the time with the patient, explaining to them why things are going to look the way they're going to look and why things sometimes will not look the way that they want. And it's not because of the inability to do something, but just their anatomy won't allow it.
Yeah. And you mentioned photographs as being important. I was listening to something online, and I this plastic surgeon said that before social media, people would come in with a picture of like a celebrity. They're like, I want to look like this. Now they're coming in with pictures of themselves with a filter. They're like, no, I want to look like this. Is that kind of a trend that you've seen? And how does that, like having a celebrity versus having yourself in a filter, how does that alter the way that you would approach somebody's cosmetic case, I guess?
Well, I mean, I think these filters, these Snapchat filters and these different types of filters have given a lot of patients a false sense of what is real and what is natural. You know, I can't tell you how often um, yeah, you see something on social media and it's completely doctored. And I'm not saying that the pictures are Photoshop, but you can take someone and they may have a little extra skin or not the best shape, but if you position them just in the right way, all of a sudden everything looks good, and then they stand back in their normal posture, they look like the rest of us. So I think social media has kind of created unrealistic expectations with what we think is like the standard of beauty, you know? So when patients bring in photographs and they say, I kind of want to look like this, if it's realistic, I'm happy to say, yeah, I think that's something that we can achieve. But if it's really unrealistic, then that's where you have to kind of explain to them that this is not something that you're going to be able to achieve unless you're perfectly positioned and postured in just the right way so that you don't see that little bit of excess skin or that little bit of cellulite.
Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.